All right, y'all, welcome. I think I saw a couple of folks who are here. Just put up a Q&A. Thought I'd give it a try this time. If you'd like to put in any questions or concerns you have about what we'll be going over today. So the 2022 data for the U.S. Trans Survey, you can actually answer that in the Q&A. You can also email us if you'd like. I will put that in the chat here. There you go. So if for any reason you can't get that to work or you want to send questions as emails, that is now in the chat box. It's admin@ccresourcing.us. But feel free to put in the chat anything that you have today as it comes up. Don't have to hold all your questions to the end or anything like that. It is limited to subscribers so that we can make sure some of the trolls and kind of junk comments don't end up on here. But if it is a problem, like I said, feel free to send that through email. I think it may also limit the amount of time in between comments. So I'm hoping y'all can see and hear me okay. It looks like we've got a few people that have showed up. Today we're talking about the trans survey. If you don't know, this was actually first put out in 2015, and they have not done another of this survey since then. So quite a gap between 2015 and then the second one, which was done in 2022. And that's most of the data we'll be talking about is what comes from the 2022 survey. And then I've got some comparisons to the 2015 survey as well, so we can see how things have come along. I just want to note, though, before I jump into the actual data or about the survey, that a lot has changed since 2022. It was towards the end of 2022, the fall of that year, that they were collecting data. So it hasn't been quite 3 years, but at least 2 years and some since 2022 data was collected. So likely the answers might be different now if we did the survey all over again. And really, that was just a snapshot in time from October through December of 2022. We'll also be talking about the US population data and how it compares to the data from the trans survey. And I think it's really important to remember that trans folks are included in that US population data. So the comparison there is really sometimes hard to make because if we actually took trans folks out of that US population data, it would likely change those numbers quite a bit. So to get a true apples to apples type of comparison would require a lot more research, but we're doing the best we can with what we've got. The questions in the 2015 survey and the 2022 survey were asked in different ways as to some of the questions were, not all of them. But that's why some of the comparisons can be hard to make as well. And some of the data is run differently too. So they might have a comparison between total respondents versus those who responded to a particular question in a particular way. And I'll try to be really clear about what I'm talking about when I mention the statistics. Are we talking overall, all respondents, or are we talking about maybe a subgroup of respondents? One thing that's always important for me as a researcher is to keep in mind that often with surveys, which are great and generally widely accessible, folks who don't have access to the technology to take the survey are left out of the survey data because they are not able to respond to it. So we are going to miss out on some folks and their answers to these questions simply because they do not have access to the survey. Again, I know that surveys can be very accessible for a lot of people, but if you don't have the technology for it, then those answers likely aren't going to be incorporated. And of course, folks who didn't feel comfortable answering the survey, they're also not going to be included in the results. And that could skew some of the statistics, but we don't know because those folks weren't included. So, about the survey, if you haven't heard of it before, it was done by the Advocates for trans equality. And this is actually a name change from the National Center for Transgender Equality. You might know that name a little bit more than the Advocates for Trans Equality, but that is a name that they just recently changed. So if you're searching for this, usually just searching by US Trans Survey is going to be the best way to do that. Over 90,000 trans and non-binary folks responded to the 2022 survey, which is huge. Definitely more than double, almost triple the number of people who had responded to the 2015 survey. And in the 2022 survey, we had like all 50 states accounted for, the District of Columbia, American Samoa, Guam, Puerto Rico, and many of the US military bases. We had folks who were in all of those locations when they responded to the questions. Also important to know with any research is definitions, like what do they mean by X, Y, or Z? And I'll talk about, for example, depression symptoms, like how did they collect that data? So we'll talk about that. But I think just knowing who the population is for this survey, they essentially said if you identify as a different gender than the one you were assigned at birth, then take this survey. So very broad in how they defined essentially who would qualify for the survey. Excuse me. Also, no ages wise. These folks were 16 and older, but the majority of the results that you're going to see, the statistics, are based on those who are 18 and older, unless they specifically note that it does include 16 and 17-year-olds. The survey, when they sent it out, it was available in English and Spanish. Those were the only two languages. And the areas of study that they looked at for the 2022 data was education, employment, family life, healthcare, which we'll talk about today, housing, life satisfaction, which we'll also talk about today, and public accommodations. Those were similar and to what was included in the 2015 survey, but what's different is the 2022 survey included a whole category on COVID-19. I'm not going to go into too much detail about that today unless you're very, very interested in that. I'm really going to focus on mental health and life satisfaction topics. So, who responded to the survey? What was the makeup? About 38% identified as non binary, 35% identified as trans women, 25% as trans men. And then they also had categories. So this is based on basically a checklist for the respondents. 2% as cross dresser, that was the language that they had used, and 5% as intersex. Sometimes surveys are limited in the identities that you can choose from, and likely that is partly why we only have this short list. If we had something where you could just write in an answer, you'd probably have a much larger list that had more diverse identities. Race wise, 1% identified as American Indian or Alaska Native, 7% identified as Asian, Asian American, or Native Hawaiian or Pacific Islander. 8% identified as Black and or African American. 14% identified as Latinx and or Hispanic. Less than 1% identified as Middle Eastern or North African. 56%, so the largest category under race, was white or European American, and 13% identified as two or more races, which they had noted as like biracial or multiracial. Age wise, 43% were ages 18 to 24, 36 were ages 25 to 44. So that gives you an idea of the majority of respondents were age 18 to 44. Just keep that in mind as we talk some more about how different age groups showed up with different questions, that the majority of respondents were from that 18 to 44 category. 9% were from 45 to 54, 6% from 55 to 64, and 7% to 60 at age 65 or older. So really, again, vast majority were in that younger age, those two younger age groups, with not quite 20% older than 45. They asked if folks were parents. 17% reported that they were parents, and 3% also noted that they were parents of trans or non binary children, which include adult children. Geographic location, as someone who is in the South, I found this very interesting that 41% of respondents were living in the South. 23% were in the West, 19% in the Northeast, and 17% in the Midwest. So that might also skew some of the data and the responses that we received. I say we, like I was a researcher, that they received. I didn't actually do any research. I wasn't a part of this. But I was waiting for a long time for this report to come out. Citizen status, nearly everybody, like 95%, were US citizens by birth, or 3% by naturalization, 1% permanent residence, and then 1% had some other immigration status. Education wise, 13% had not completed high school, 35% had completed high school or GED, 26% had completed some part of college. They hadn't graduated from college, but they had maybe either done some college and dropped out or were currently in college. 11% had a bachelor's degree, 7% had associate's degree, and 7% had master's degree or higher. So again, the majority was in that completed high school and maybe a little bit of college. Some of the pieces of information that I thought were additional context for us to keep in mind as we're thinking about what the overall numbers are when we head into mental health specifically. They looked at the impact of unequal treatment. 40% of the respondents had thought about moving to another area because they had experienced discrimination or some sort of unequal treatment where they were living. Again, this was in the fall of 2022. I imagine that number to maybe be higher at this point, that folks had thought about moving, might be greater than 40%. I don't know, but that's just kind of a guess based on some of the trends that I'm seeing right now anecdotally. 10% had actually moved to another area due to discrimination. Nearly half, so 47%, had thought about moving to another state because of the laws, policies that their state had in place regarding trans folks. So this might be banning access to bathrooms, to healthcare, banning access to sports. Um, and 5%, so nearly half had considered moving, and actual 5% did move out of state. And we have the top 10 states that they moved from. And my home state here is on this list. So the top 10 states that folks moved from were Alabama, Arizona, Florida, Georgia, Mississippi, North Carolina, Ohio, Tennessee, Texas, and Virginia. Majority of those are in the South, especially the Southeast. And I'm also thinking of folks who responded were majority from the South, but this might have been before they moved. We don't really know what states they moved to, but how that might have affected the data. I'd be interested to see. For the 2015 trans survey, they did put out state specific data reports. So I will keep my eye out for those, and I can let you know when the state specific reports are out if you're interested. Mental health wise, 44% of respondents met criteria for serious psychological distress. And that is compared to only 4% of the general US population that reports serious psychological distress. It was greatest for the ages of 18 to 24. but only 11% of 65 and older met that criteria. The majority also indicated, so 81% indicated that they felt down, depressed, hopeless for at least several days over the past 2 weeks. And we know as mental health providers, this lines up with that major depressive disorder or depression episode criteria of feeling down, depressed, hopeless at least several days over the past 2 weeks. So there's the potential for the majority of folks to meet some of that depression criteria. And that 81% is compared to only 57% of the US population. Three-quarters of folks reported little interest or pleasure in doing things at least several days over the past 2 weeks. Again, one of those key criteria for depression or a depressive episode. This is also higher than the general population, which was 58%. So you've got 81 to 57% and 77 to 58%. Not quite double, but getting close to that. Regarding suicide, in the year prior to the survey, 38% had considered suicide. This is compared to only 5% of the general US population. So that's also a big difference. 16% of all respondents had made a plan, which is compared to only 1% of the general population. If you read the 2015 data or you've been to any of my trainings where I talk about it, you know that these are huge gaps between the folks who are responding to the survey, so trans and non binary folks, and the general US population. They noted what they called like greater suicidality, which would be considering suicide, making a plan, or attempting suicide. This was associated with the victimization of those respondents. They noted 50% of folks had been verbally harassed, 53% had been denied equal treatment or service for any reason, which could include a place of business, the government, an agency, or any sort of public space, and 63% physically attacked. So again, it's greater the percentage of folks with suicidality that was associated with victimization versus those who hadn't experienced it. Those numbers were much lower. Lifetime suicide experience, which was one of the key stats that was taken from the 2015 data, also again was asked in the 2022 data. So we are able to compare this. It was noted that over the lifetime, 78% had considered suicide. This is compared to only like 13% of the general population. 40% had attempted suicide. So that is compared to 2.4% of the general population. Big difference there. I know when I was looking at the data previously, it was about 9 times the US general population who had attempted suicide across a lifetime. And for this one, we're actually getting closer to 16 times that number for those who had attempted suicide. There are protective factors, though, for suicide, and they looked at family rejection and families who were supportive versus those who were unsupportive. So, those who experienced family rejection were more likely to report that they considered suicide or attempted suicide, but those who had supportive families reported less suicidality as compared to those who noted they had unsupportive families. That's a really key takeaway from today, if nothing else, that protective factor of social support. And from this data specifically, we're talking about family support. There's a whole section on experiences with mental health providers that I think is really helpful for us as mental health providers to figure out not only like what's going on in our field, but how we can do better. I'm gonna end the Q&A since nobody had answered it. The chat should still be up. Let me know if not. You can always email if needed. Just want to make sure I'm not missing anything. So, in the year prior to the survey, 58% had received counseling or therapy from a mental health provider. That's 58% compared to only 22% of the general population. This was different based on education level and income. So, those who wanted therapy was the same across all the education levels, but those who had less than high school degree access care much less than those who had masters or higher. Those who had different income levels also wanted counseling at similar levels, but it was much lower for those who had no income than those who made 100,000 or more. While 78% wanted counseling, specifically related to gender identity or gender affirming care, because in some places, insurance and states will require that you get a letter or that you have therapy for a while. So there's this particular answer, I think, can go both ways. Some folks do want mental health counseling regarding gender, and some need it so that they can access gender affirming care. But regardless, lumped in together, 78% wanted counseling related to gender identity or gender affirming care, but only 48% received it. So that also is a huge gap between those who want counseling and those who are able to access it. Some of the good news, I think, is that 71% of those who were receiving counseling discuss their gender identity with their mental health provider. Hopefully, that means that we are creating spaces where folks feel comfortable opening up about their gender identity or need for gender affirming care. But of that, some of them did open up because they wanted to process something around their gender identity. That was about 48% of folks. But 25%, even though they mentioned to their counselor about their gender identity, that was not the main focus of their counseling. Now, the concerning piece of this is that among those who had discussed gender with a counselor, 12% reported that their mental health provider tried to persuade them to identify with their sex assigned at birth. That's 12% of counselors. So not everybody didn't even receive counseling, but then those who did, 12% had a counselor who was trying to persuade them to identify as their sex assigned at birth. And this was much higher for those who sought counselors that were maybe religious based. That was 50% of those folks that had that experience. So those religious counselors or therapists were pushing harder to persuade them to identify with their sex assigned at birth. I will note that only 7% of folks received counseling from religious counselors or therapists. And sometimes this, based on how the question is asked, can overlap with religious advisors. So some of them may not have like a license, they may not have a certification to give therapy. They might just be someone at some sort of leadership position at like a church or synagogue or something like that. Substance use wise, there was actually some good trends here that I'll mention in the key takeaways. But just so that you're aware, with alcohol use, this was pretty comparable for the 2022 trans survey with the US population. So this included beer, wine, hard liquor across the lifetime. It's 84% for those who responded to the survey and 84% for the US population. There were actually lower rates of alcohol use in the last month as compared to the US population. And same then for binge drinking. So this was actually lower for the US trans survey respondents than the US population in general. They did note that for binge drinking, it was more common for folks who met the criteria for the psychological distress. So that's, I think, something to keep in mind for us if we're working with folks, whether on substance use or not. They may be at greater risk of binging alcohol if they have serious psychological distress. Cigarettes also trended lower, so lower rates of having ever smoked a cigarette than the US population, lower rates of smoking in the last 30 days, as well as lower rates for smoking every day as compared to the US population. They noted that the older respondents tended to have higher prevalence of current smoking, with the exception of that like highest group, 65 plus. And I'm sure that has to do with access to tobacco or cigarettes, as well as some of the social expectations around cigarettes. And then for that oldest age group, maybe concern for health, something like that. On the flip side, for e cigarettes or vaping, the US Trans Survey actually noted higher rates than the US population, actually almost double. Higher rates in the last 30 days as well, which again was almost double. And also, the reverse of the cigarettes was that younger respondents were more likely to be current vape users when compared to the older respondents. Another category they looked at was marijuana and hashish. So much higher rates of those who had ever used at some point in their lifetime, more than double the rate in the last month as compared to the US population. Current marijuana use, it did depend upon the age group, with the majority being the 25 to 44-year olds. And those 65 plus were at the lowest use. However, on the flip side, the daily use was lowest among the youngest respondents versus older respondents. So I found that interesting as well, that even though maybe older respondents aren't using it like over their lifetime, or over the last month, but those who do are using it more frequently, using it daily. For illicit drugs, they asked about cocaine, heroin, LSD, and inhalants. And the use at some point in the life was 27% for the US Trans Survey. There's no data on this for the US population, so we don't really have anything to compare to. However, use in the last 30 days can be compared and is actually the same at just 4%, the same as the US population. The use of illicit drugs did peak among the 25 to 44-year-olds and then continued to fall as folks were older, with the lowest being in the 65 plus. Use of illicit drugs did not differ, though, by serious psychological distress. So that is a good sign there. Non-medical prescription drug use was something else that they looked at, and they said for the use at some point in the lifetime of non-medical prescription drug use, it was 26%. We also don't have anything to compare to that with the US population, but we do for the use in the last 30 days, which is 4%. For the US Trans Survey, is exactly double the US population of 2%. Those who met the criteria for serious psychological distress in the month prior to the survey had more non medical prescription drug use compared to those who did not meet the criteria for severe psychological distress. They also asked if respondents had noted any problem in their life with drug and or alcohol use. And about one quarter said that they did have some problem with drugs or alcohol at some point in their life. 27% of those met the criteria for that severe psychological distress in the month prior, um, as those who reported ever having a problem with drug or alcohol use, compared to only 23% of those who did not. So, not that big of a difference, but it still is appearing like that psychological distress is playing a part in substance use. 55% of respondents said that they were in recovery, which is 14% of the total group of respondents for this survey. So, for those who noted at some point they had had a problem in their life. 55% were in recovery, but only 14% of the overall group of respondents noted they were in recovery. And I think with this particular answer, it appeared that the participants maybe didn't exactly know what recovery meant, or maybe it meant something different to them than someone else. So, with various definitions of being in recovery, we may not clearly see that answer there. But the best we can do is with those who said they were in recovery. All right, we're about somehow 30 minutes in, so I'm just checking. I don't see anybody having put anything in the chat. So I'm going to keep going. I don't see anything in the email either, but just know you can always plug something in. I know it's pretty data heavy, so I want to take a second to compare the 2022 data to the 2015 data and give you some key takeaways of how to apply that before I get into what I think is the best part regarding happiness and life satisfaction. So, a quick note, I mentioned earlier the difference between the 2015 survey and the 2022 survey in terms of number of participants. So, we had basically like triple the number in the 2022 survey than we did the 2015. And this, of course, can adjust some of those percentages. Maybe there was a greater reach of respondents for the 2022 survey. So maybe there's a better view, really, of the population versus a smaller sample that was in the 2015 survey. However, like I mentioned earlier, there are still going to be many people who didn't respond to the survey because they didn't have the technology they needed to access it, or they didn't feel comfortable answering the questions. I also found that some of the questions in the 2022 survey weren't asked exactly as they were in the 2015 survey. So some of the questions with different wording can lead to different results as well. And one, like, just example straight off, is the happiness and life satisfaction section wasn't in the 2015 data at all. They didn't ask those questions. So we only have answers to those questions for the 2022 folks. And hopefully they'll do another survey soon-ish. I know they're still crunching the data, so it may take a while, but it would be great to see more regular numbers on these so we can keep track and see what the trends are. So, here are some key takeaways. Overall, respondents in the 2022 survey had higher rates of psychological distress. However, they had lower rates of contemplating suicide, making a suicide plan, or attempting suicide. So, that's a good sign that those are lower rates. There were similar rates of lifetime suicide attempts. As far as I could tell, it was like 40, 41% ish. So that did not change at all. There were lower rates of receiving mental health counseling if they wanted it. So that's a little concerning. They talk about it some more in the report if you're interested on what some of those barriers are, which we have talked about and I've talked about in other trainings. But it just kind of shows how from 2015 to 2022 that access to mental health counseling appears to be decreasing. There were similar rates of folks who discussed their gender identity with their mental health providers, so that didn't change that much. There were slightly lower rates of mental health professionals attempting to persuade them to identify with their sex assigned at birth. Again, good that it's lower, not great that there's any percent there, so that we still have some work to do in that area. Those who experienced family rejection were more likely to report attempting suicide, but overall, there was a decrease in attempts. Those with supportive families re- who reported ever attempting suicide versus those who had unsupportive families, those statistics actually were pretty similar. So that's another area that, especially for those of you who are family therapists, this might be data to help bring into those conversations if appropriate. There were lower rates of alcohol use across the lifetime and the last month, as well as lower rates of binge alcohol use comparing the 2015 to 2022 data. Lower rates of cigarette use in the lifetime of the yeah, of lifetime last month. For cigarettes, it was lower, but higher for everyday use of cigarettes. So just breaking apart those, overall for alcohol, all lower rates, but cigarettes were lower for lifetime and last 30 days, but higher for the everyday rates. There was also higher rates or have ever having used e-cigarettes or vaping, but lower rates of use in the last 30 days. I also think that might have something to do with some of the societal expectations or how, in general, it's seen as good or bad. I think a lot of folks saw that as a replacement for cigarettes. So they were using e cigarettes or vaping instead. And as the research has come out about health related to that, I think folks are trying to decrease their use of e cigarettes or vaping. So that's likely why we see those numbers. The marijuana and hashish use increased, and I think this is possibly linked to the fact that the use is increasingly legal in more places. Sometimes it's just for medicinal uses, but sometimes it's just for recreation as well. So it might make sense if folks have easier access to that. It's legal, they might use it more. There were similar rates for illicit drug use that didn't really change, but lower rates of using non medical prescription drugs. So, in general, I would say we have a lot of great changes that have happened from 2015, but there are still some things that we really need to be aware of. That severe psychological distress, folks who wanted to or who were moving, some of the use of drugs or alcohol, just knowing where that's at with clients. And then again, that social support, especially family, knowing that supportive families are such a huge protective factor for trans folks. That's something that hopefully we can work on with our clients. If you want more of the percentages, I can actually dive deeper into those. Just let me know. I have those pulled up, so I'm happy to go into it. But I do want to talk about the happiness, life evaluation, and life satisfaction that was found in the 2022 survey. So just remember that this was not in the 2015 survey. So I don't really have anything to compare it to. And I'll break down each of these categories. They did define them, so we know what happiness means for the survey. The definition was a general emotional state reflecting feelings of joy and contentment in daily life. So they asked the question of respondents to evaluate their general happiness by saying, generally, how would you say things are these days in your life? Sounds like a mouthful, but essentially they're asking from a scale of very happy, pretty happy, or not too happy, how are things in your life going right now? And the majority actually noted that they were very happy or pretty happy. So that's great. That's 66% of all respondents noted very to pretty happy, with 55% noting pretty happy and 11% very happy. However, there was one third who indicated that they were not too happy. So that's something for us to check in with clients, maybe around values, the type of goals that we have, the work that we're doing. How happy are they with their life? They did note that the majority of folks who had taken steps to affirm their gender were very to pretty happy. So that includes folks who had like hormones or surgeries, as well as folks who were changing like the way that they dress, their clothes, their hair, things like that. Use of pronouns, they incorporated all of that and just noted that those who had taken steps to affirm their gender were very to pretty happy, more so than those who had not. Life evaluation. The definition for this was current and anticipated future life quality on a continuum from negative to positive. So this was done using the Cantrell self-anchoring striving scale so that they could gauge folks' perceptions of their current and future lives. It was split into thriving, struggling, or suffering. About a third of folks, so 30%, reported that they were thriving. So this is a good sign as well. Their current life satisfaction was rated highly. They were optimistic about their expectations for the future. However, while that's a third and it's great for this particular study, that's compared to 53% of the US population at that same time. So it is lower than the US population, but one third is a pretty significant amount. Again, those who had taken steps to affirm their gender noted thriving more often than those who had not. And while a third said that they were thriving, the majority, or 63%, said that they were struggling. So, not thriving and not suffering, but 63% were struggling. And this is compared to only 43% of the US population. So greater numbers of the US population are thriving and less of the US population are struggling as compared to the US Trans survey. Only 7% noted that they were suffering, so they indicated a much lower quality of life and maybe a bleak future expectations compared to only 4% of the US population. So while 7% doesn't sound like a lot, it is still greater than the US population and something for us to be looking at. What's the gap there between thriving, suffering, struggling? How can we help clients bridge those gaps? You might I don't know how you feel about positive psychology, but that could be something to incorporate if appropriate, and you can kind of make it your own. I know I've looked at positive psychology to address suicide risk for trans and non-binary folks, and I was able to incorporate those different positive psychology activities in a way that makes sense for trans and non-binary folks. So if you're looking at ways to increase that, as you work with clients, increase ways of focusing on life satisfaction, positive psychology may work. Just check those activities and see how they'd work with your individual clients. I think ACT is also good in this regard, that it focuses a lot on values. So rather than values being some sort of goal that you can accomplish and check off your list, these are larger areas of your life that you want to focus on, maybe spend more time, energy, whatnot. And that could be helpful as well when working with trans clients. Life satisfaction was defined as a deeper sense of fulfillment and contentment in one's life. And a little over a third reported that they are satisfied. Overall, they are satisfied with their life. But over half, so almost 60%, reported some variation of dissatisfaction. 4% were neutral, so they weren't really satisfied or dissatisfied. But those numbers of dissatisfaction, 60%, much higher than those who were overall satisfied. Although, again, a little over a third is pretty significant. Those who had taken steps to affirm their gender reported substantially higher life satisfaction. So you're looking at like 43% versus 25%. And 98% of those who were using hormone therapy, they noted that they were more satisfied in their life. 98%. 97% of those who had had a gender affirming surgery noted that they were more satisfied in their life. I think this reflects some of the anecdotal research as well as general research for trans folks who have used hormone replacement therapy, HRT, or a gender affirming surgery of some sort, that 98, 97% being more satisfied with their life is pretty consistent with other research that I've seen. Younger individuals actually had the lowest levels across all measures. So, looking at ages 18 to 24, only 58% were happy, only 20% were thriving, only 27% were satisfied with their life. So, I know that for younger individuals, it's a very stressful time, might not have as much autonomy. That could contribute to those lower levels. For older individuals, So we're looking at 65 plus. They actually reported the highest levels across all of those measures. 82% were happy, 55% were thriving, and 61% were really satisfied with their life. So it's an interesting comparison across all of these different areas between younger individuals and older individuals, being that many of them, they're kind of exact opposites on each category and in different ways. But I thought that was interesting with the older individuals being happy, thriving, satisfied with life. These folks might have kind of created their own families. They might be happy in whatever job or housing situation they're in. They have more autonomy. So that could all increase those different levels of happiness, thriving, satisfaction with life. I'm happy to go over some more of the statistics or talk about the survey in general. Those were the key points I wanted to bring up, though. So if you have specific questions, you want to put those in the chat or email me, let me know. Um, Otherwise, those were the key points I wanted to highlight and really end on that happiness of the good numbers that we are seeing with regards to happiness and life satisfaction, but also the gap that we have as therapists to help our clients. So let me know if you have questions. I'll be around. Um, Happy to look at other parts of the reports or go back and dive into any of the specifics you might have. If you'd like, I can put some of the links here so you can go and look at the other reports if you'd like. Put that in the chat. So if you go to the website there, you'll see at the top is the first three are from the 2022 survey. So the health and well-being report that I just mentioned, they have a civic engagement report, and then the early insights report was the one that they first put out actually last year. I think the hope was that towards the middle or end of last year, all the data would be released, but it's still slowly coming out. At the bottom, you can see the 2015 reports. So they've got complete report, executive summary. They have many of these in Spanish as well. They have reports broken out as far as people of color and different races. They have military service, bisexual trans folks, and then there's also reports by state. So if the state had enough respondents to be able to keep it anonymous, then each state had their own report. So you might be able to find your state there. It looks like most of the states are listed. The 2022 reports, they don't always compare what the 2015 report said. So if you're pulling up both reports and trying to compare, just know again that some of those questions weren't asked in the 2015 survey. So you might not have data to compare there. Know that some of the questions might have been asked a little differently. They do include the questions that they ask. So if you're a super nerd like me on methods, you can go and look at that, at the different questions that they ask and the different ways that they assess for things. I'll hang around. If you need to head out, please do. If you have questions or concerns, feel free to put it in the chat and I can answer those. I can answer them later as well. So if you don't think of anything, want to come back and put it in the chat or email it to me, I would be happy to answer those. Absolutely. Happy to help. I really enjoy reading through reports and getting into statistics. So happy to, pull it all together and hopefully put it into terms that are easy to understand. And as the other reports come out, maybe I'll keep doing this. I'll keep bringing up some summaries of the reports. So if you're not inclined to read them all the way through, I can let me know which reports you'd like me to go over. Of course. Thanks y'all for being here. All right, I'll go ahead and end it. But if you want to come back and watch again, please do. Or if you have questions that come up, don't hesitate to reach out. Thanks y'all for being here.